Thank you for taking a moment to learn more about the Dignity Compass. The goal over time is to use this as a tool of analysis, as a mapping process that will help you find your celebrations and your critiques so you can bring insight into your organization. And ultimately, the goal is utility, that this is a useful tool that will help your organization navigate your way forward. It begins with the dimensions of dignity, which are organizational, relational, and personal. The organizational is really place-based. It's about the community where the institution exists. This is typically a physical space. There are political structures and histories, a culture that comes with the organization, whether school, hospital, or government. It's really about the resource allocation, right? Creating and interpreting, implementing policy. And there's a lens of administrative leadership where we think systemically and historically. The relational dimension is really about the provider and the end user. So in schools, that would be from teacher to student. In healthcare, that's from doctor or nurse to patient. So whatever organization exists, there's a service provided, and whatever role people have in these organizations, it could be from a manager to a team member if they're not serving clients directly. This is all about a humanizing experience of the interaction. What are the tools of engagement? What happens when the client lived experience is not honored? How are organizations bringing in the cultural capital and thinking relationally and historically? The personal dimension is really about critical reflexivity, this idea of self-location, this practice of noticing our biases, our privilege, our positionality, identifying our formation and enactment of these various identities. This is often very difficult and slow work. It requires authentic caring, an abundant amount of grace for oneself and others. And the goal here is to think introspectively and historically. You'll notice thinking historically applies to all of these three dimensions as it is critical to doing the work of dignity, equity, and belonging. Implementation science offers us the solutions to what we know are our world's problems. We already know how groups of people can get things done. The degrees of implementation and implementation science come with policy, what gets codified, action, what we're actually doing over time, and ultimately the impact. What are the results? What's our performance? And so, as noted here by Fixon, it is clear that paperwork in file cabinets plus manuals on shelves do not equal innovations, but without these, there is no direction. When we get to action, these are all measurable. They are line items in our budgets. They are calendar dates. They are our personnel org charts. So we can measure all of the activity in organizations to see how we are getting to our goals that were set in policy. And then finally, the impact or the measurement is that final tally. How do we know that we're producing the results that we set out to? The Dignity Compass crosses the degrees of implementation science and the dimensions of dignity to create a 9-part rubric that forms a Dignity Compass. The goal is to navigate organizational direction over time, use it as a mapping tool to identify actionable strategies, track and measure our progress, as well as communicate the overall vision. So let's dig in. Often when I'm called to do equity work or when folks focus on this and really thinking about how are we honoring the dignity of all of our people, whether that's in the system or our clients that we serve, we go to this personal action when we're investigating the critical reflexivity, right? This very difficult work of acknowledging all of our positionality. Again, it's difficult and slow. Does the organization have a readiness and capacity to offer this caring and grace that's needed? And is there time provided to do the introspective work? Now, often I see there's no readiness in an organization to do this. Who's already champion of these efforts and not acknowledged? How was the training selected? Is there other coaching involved to further the learning? Is it budgeted for annually? Is it calendar? And then often a wall goes up and we potentially do more harm than good. So I want to come back to ask, what is in this personal realm, in this dimension, what are the policies driving? What research is driving these policies to say, we are going to use these theoretical frameworks. We want to invite this common knowledge or common expectations into our organization to support each individual and their personal growth. What are the knowledge, skills, and attributes that we want to foster in the organization? That will drive then the actions and the calendar dates for the next phase. In addition, it gives us the measurements that we can move forward with. So what are the personal impact measures? Well, we can look at sociocultural consciousness, looking at the knowledge, skills, and attributes and measure these over time to identify the commitment and skills of all of our personnel to act as agents of change. Is there a constructivist approach that we're actually taking and the learning from? Do we have shared mental models and shared language across the organization? This is the work that can be done in the personal dimension of dignity. However, there are other levers to pull. For instance, we can look to the organizational policy. And I have here the London Olympics to share a short story that the goal of this Olympic committee was to have the most diverse workforce in all of Olympic history. One thing that they put into policy was to support individuals who were not hired because they had poor resumes or CVs. So what the structure did is provide CV and resume support to applicants who did not make the first cut. Once all these resumes and applications were resubmitted, well, what do you know? It turns out there were more folks in the pool to rise into these various positions, and they surpassed their goals of having one of the most diverse workforces in an Olympic system. So this is about the engagement of the community. How are we selecting our resources? What are data responsive decision-making tools set in place by policy? Do we have trauma-informed, healing-centered dignity policies that give us direction? There's a lot of HR in here, thinking about the inputs and selection, as well as recruitment and retention, the utilization of universal screeners for everyone in the organization, whether that's students in schools or patients in healthcare, in all of our systems. This will drive that organizational action. Again, looking at our budgets and our calendars, all of this can be counted. Where's the programmatic equity in our efforts? Is there proportional representation that we are set forth in policy that we're actually meeting? How are we utilizing these universal screeners to capture client voice and influence our own practice? What do we have in place for the selection processes where individuals in a system go from one point to another? In schools, that may be a system for like AP or IB courses. In companies, we're really looking about how do promotions occur? How are those selection processes occurring? Are they equalized across the system? And finally, when we get to the organizational impact, we'll know that. We'll know our per client expenditures. We'll know if our goals are hit in terms of proportional representation, our practitioner quality, how many master's level teachers do we have, what kind of resources and training have our managers experienced. And so we really get to this kind of achievement equity, right? We can disaggregate all of our data and get to some numbers. For schools, again, this looks like test scores, dropout rates, and all the data that comes with doing school. The model, though, works for many systems and many organizations. What do you really want to measure at the end of this in the organizational dimension? Next, we have this relational policy or the relational dimension that will drive if we are honoring our identity and dignity as a policy. One simple example for me is to walk into a Ross store, a Ross Dress for Less. Don't know if you shop there or not, but I know every Ross I walk into, I'm always greeted by somebody. That is a policy, a relational policy that says to our employees, we will greet every customer as they come in. What does that do, right? It humanizes the experience. And in addition, as we think about this relational policy, how do we historicize the experience of our clients? Are we inviting the critical thinking, right, of our staff and our clients, considering the intersectionality of our clients? Are we inviting the funds of knowledge? What do they already know about their own lives and desires and outcomes that they are seeking? Are we engaging in restorative practice? Are we setting this forth in policy when conflict does occur, either internally among our teams or with our end user and our clients? Are we involving the staff and policy in terms of developing social emotional learning that will drive us forward into doing the relating? So often teachers love this part here, the relational action. This is the art and skill of teaching, right? Is it client-centered, student-centered, a narrative? Are we inviting the voice and the agency? I know for my own personal experience with healthcare, it's not always a dignified experience. I don't always feel humanized as a patient going into these systems. Are the materials and strategies matching the client's cultural experiences? This goes a long, long way in all of our services to the end user and client to see if they actually get what they need in a way that works for them. Right? Again, involving that cultural capital. Are we tapping into this aspirational, familial, linguistic, or navigational capitals? Are we honoring the life skills and knowledge that the client already comes with? Are we honoring the place-based nature of this interaction, especially as we think about communities that have high levels of immigrant populations welcoming to this place? And then finally, the relational impact gets to what is the evidence and artifacts? How do we know the client's lived experience was honored? How is the client involved in this measure? Are we developing a consciousness from our provider to our client about that experience that the client is having? Do we have these traditional measures that we actually take back to policy to say, here's the results, how do we change and shift our policies so that we can meet the needs of our clients? This creates the 9 areas of the Dignity Compass. Perhaps even just in this short walkthrough, you can identify one area of celebration in your organization. What has occurred in the past 2 to 3 years that you can definitely identify and say, we are strong in this area. Here's the action, here's the policy, here's the impact that resulted in this wonderful, wonderful celebration. We want to acknowledge all the work done. Is there one area of exploration and you think and consider, where is the organization not doing well? This can be used just in a conversational tool, but to take it to the next level, it's going to require an implementation team or a tier 1 team. So from the policy, we want to drive the work in a team. We know in implementation science that things really get done when there's a team getting it done. And so this team will be made up a cross-hierarchical team. And so you want to think about all the positions in your organization and how you gather a diverse group of people to be on this team. Anywhere from 6 to 12 folks is recommended. They will identify the indicators, the actual measures in each of these 9 areas. It's only recommended that you have 3 criteria per area. In the tool of the Dignity Compass, I've identified over 400 indicators that we could choose in each of these areas. So this is the real decision-making power of what do we want to measure, because we measure what we value. This will determine where we want to direct the organizational goals. It's intended to measure every 6 months, and over time we can adjust and see from the measures, create a responsive work plan, and continually revise that work plan. The team or the organization can score this either in the team amongst themselves or organizational wide with surveys and the like. Thank you for taking a moment to learn about the Dignity Compass. If you'd like to learn more, please reach out to me, Vincent Perez. You can also find me through the other organizational efforts I have, the Equity Institute, La CIMA, and Rethink Management. Thank you so much.